Spinal pain. First of all, how important, how frequent is it? Is it something that is pretty rare, or does it happen rather often? Well, when it comes to taking care of documenting and really watching this kind of thing, there's nothing like insurance companies where they watch the bottom line. And so insurance companies, workers' comp, for businesses, they really know a lot about how much back pain there is. And in statistics that I know of from long ago, and I'm sure it's the same now, 50% of the money that is spent for workers' comp problems, in other words, all the injuries and all the health problems that happen at work, is because of back pain. 50%. In other words, it's as much as all the other things put together. Is that frequent? You better believe it. They say that in the population as a whole, 80% of the people will at some point in their life have back pain bad enough that they won't be able to work for a while, at least a day or so. I'm probably talking to people that some of you may have experienced back pain already. Spinal pain is more than back. It actually includes the neck too. And neck problems are not too far behind back problems. When I said 50% of the workers' comp claims and the money spent is back, it's actually the low back. For the neck, when you check it out, it's not too far behind. It's, if the low back is maybe 50%, the neck might be 25 or 30% of, frequency and severity of pain problems. So what we're talking about, if we put it all together, low back and neck, is a huge amount of human pain and problems. Perhaps as much as anything else put together. Now, we think of pains as being, warning of something terrible like heart pain, angina. Of course, that is a real omen of something bad, death that could happen. But in terms of just pain that people suffer, there's really nothing that is so frequent as spinal pain. So I hope that you can see that this is a pretty big issue. So, see if I can get it to work like Seth told me to. Now, when we look at the spine, you've got three major regions that it's often divided up into. Up in the neck, what's called the cervical spine, and it has 7 vertebrae. How many vertebrae does a giraffe have? 7. It does, even though it's so long. Thoracic vertebrae are those brown ones. There's 12 of those for the 12 pairs of ribs. And because the thoracic spine has all those ribs and the rib cage stabilizing them, the thoracic spine does not move as much. It doesn't twist as far. Our neck does a whole lot of twisting, and you can quickly tell if a person has a kink in the neck. Someone calls them from over there and they turn their whole body to look at the person. The low back also has a fair bit of mobility compared with the thoracic spine. So the middle of the back, or the upper back, the thoracic spine, does not have so many problems because it's not put under the kind of stresses that the low back is, or that the neck is. The low back is what we call the lumbar spine. That's the yellowish ones at the bottom there. 5 lumbar vertebrae, and then the sacrum at the bottom, and the tiny tailbone, the coccyx. So that's what we're going to be talking about. This is the anatomy of it. Now, really, when we're talking about the spine, the picture we had before gave us the most important feature of the anatomy, and that is joints. Now, there are joints that are not in the spine. Got a hip joint, and lots of people have trouble with their hip as they get older. Often it leads to surgery. Knee joint problems, shoulder joint problems. But what I just said at the beginning is that the spine outdoes all of that joint problems from the limbs. Now, inside the spine, you've got a very important structure, and that is the spinal cord. Here you've got a picture of the spinal cord running in the middle, up and down. It's considered part of the central nervous system, like the brain is. It's clothed in a whole system of membranes to protect it from damage, the meninges. And then from every level between, let's see, can I go backwards here? Between every two vertebrae, you can see the vertebrae individually, I hope. You all see the individual vertebrae up on the screen there. Between every two of them, out come a pair of spinal nerves, nerve roots, to the right and to the left. And those nerve roots, if you take them from all the way from where the neck joins the head down to the tailbone, it's really quite a few. You've got something close to 30 pairs, so 50 to 60 nerve roots. And those take care of pretty near everything that we do with our body. All our hand movements, all our walking is because those nerve roots are working. All the sensation that we have in our body is because of that, except for some areas in the head. Now, if you have trouble with some of those joints, it can reach the point where it starts pinching on nerves. And of course, you'll know that if you're pinching on a nerve root. How many joints would it be in the spine? Well, later on, we'll have a picture of how you have the disc joint, and then you have other joints between every two vertebrae. So it's quite a few joints. We'll get to that later. This doesn't seem to move for me. Okay. Here, you've got an indication. This one is actually too fine a print. But you can see this, that these nerves from the spine actually go out and affect not only muscles that work, but they give sensation and give directions to other parts of the body. You can see where the nerves go to the lungs, to the heart, and just a whole lot of things. Let's see if we've got another one here. There we are. The liver, pancreas, the adrenal glands, and so on. All of these can be affected, are affected by nerves that come from the spine or are closely associated with the spine. So it really has to do with a whole lot in the body. Now we want to take a closer look at the vertebrae. So you can see there, let's see if I can show these things. The spine is really a pillar. It's the pillar that our body is dependent on, that the body rests on. It bears the weight of the body. So here you have one vertebra and here's the next. And in between the two, you've got that strong cushion called the disc. So you can see it there. I'm supposed to be able to use a pointer here. Yeah, so there you've got the disc. The outer tough area of the disc is called the annulus. It's rings of very tough fiber, very tough cartilage. In meat, they call that the gristle. In the center, and it's not that easy to see on this picture, there is it shows it as an oval-shaped area. That center is not tough. It is actually a cream or a jelly. And that is the nucleus of the disc. And one could ask, well, here, why does it have that structure? Well, the tough outer area, the annulus, those rings of tough fiber, that's easy enough to understand because the spine, is carrying all the weight of the body, and so the disc has to be as strong as the bones, the pillars that are the vertebrae. The disc has to carry all the weight. So you can see that all the weight that's on this vertebra is going to be carried by the next one, but the disc is in between, so it carries all the weight just as much as the vertebrae do. So the annulus has to be tough, but there's another demand on it. It has to be flexible. We don't want the spine to be just a cement rod that supports us. We want it to be able to bend this way and that. And so the annulus is cartilage. Now, one cartilage is the one of our ears. It can bend around. I think the disc is a bit tougher than that, but it does bend, a little bit. It's actually many discs that are involved when you bend to one side. It's not just one. Each one gives a little bit, and as you add them up, it becomes quite a nice bend. Think of all the directions that your neck can move, turning and bending backwards and forwards. All of that is because the cartilage is flexible. So it has to be very strong, and it has to be somewhat elastic, flexible. But why would the center be a jelly? Why did the Lord make that a cream puff? Does that make any sense? Someone's saying no. It's hard to understand. Well, notice that the jelly center is totally surrounded by that tough cartilage. It's totally contained. What is it that holds a car off the ground? What's the car sitting on? Tires. What's the tire filled with? Air. That's pretty insubstantial. It's air, like this air that's right here. How could it possibly hold up a car or a truck? Well, the reason is it's totally contained. If the tire is a good tire, there's no leak, and if the air is contained like that, it can withstand lots of pressure. Well, this nucleus is just as well contained in a healthy spine, and if you want flexibility, there is nothing more flexible than a liquid, which is what you've got in the center. You can see several other things of anatomy here. You can see that in the front of the spine, running right along here, is a tough ligament. Whoops. I didn't want that. Anyway. And then behind is another ligament running there. And in back, you have ligaments between different vertebrae. And here at the back, you can see the bones jutting out from the body of the vertebrae. These bones are what the ligaments and muscles attach to.
Sorry.
Oh, okay. Thank you.
Yeah, and don't pinch.
Oh, okay. There we are. Thank you, Seth.
Sorry, you have to hold. Okay, there.
These bony prominences in the back, this one, that one, are pretty important because, like we said, that's where the ligaments and the muscles attach to that allow you to do all the movement. Those are the one part of the spine that you can actually feel. If you run your fingers in the middle of your back, you can feel those bumps. And you can feel the separation. You can feel a little valley right between these two. And then you feel the next bump. Otherwise, it's all hidden down deep. Okay, now maybe there is one further thing that we should show, and that is, aside from the disc area, which is the main weight-bearing surface of the spine, that's the part that does most of the function of us being held up. But aside from that, which is a joint, that's a joint. That disc is the cartilage of that joint, where one body sits on the next body with the cartilage between the disc. Aside from that joint, the big one, there are little joints in behind, and you see them right here. That is a joint with a prominence of bone coming from the lower vertebra and another one coming down from the upper vertebra. The name they give that joint is zygoapophyseal joint. In actual practice, most physicians call them facet joints. Now, the facet joint is not just one between two vertebrae. You've got one on the left and you've got one on the right. So how many joints are there between every two vertebrae? You're saying 4. Al? It's 3. The disc is right at the center. It's just 1. The disc joint is 1, and then you've got a facet joint on the left and a facet joint on the right. So you got 3 between every 2 vertebrae. Well, how many joints is that going to make in the whole spine? Well, you've got 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar. How many does that make? Makes a total of 24 joints. And you got to multiply that by 3. So you got over 70 joints. Did I say 24 joints? I meant 24 pairs of vertebrae. And every pair has 3 joints in it. So you can see you've got an awful lot of joints in the spine. And so you can see that if joints are having any problem in the body, you can certainly have that trouble in the spine. Well, one can see there's quite a structure to all this. Dr. Calvin Thrash, who was part of the founding of Uchee Pines, he sometimes would say, isn't it amazing the tremendous structure that evolution has developed blindly? Of course, he was joking about that. The reality is that the Lord made us fearfully and wonderfully. All of that tremendous structure. One could ask questions about why he did different things. We dealt with one of those questions of why the structure of the disc is the way it is, the jelly in the center. One could ask, why is it that the spine has the curves that it does? Why didn't the Lord just leave it all straight? See if I can go back to that. Do you notice that right from the top down to the bottom, it's got curves in it? This doesn't name the curves, but there are actually names for it. You can see the person that's facing this way to your right, he's got a curve. If you looked at it up in the neck, he's got a curve that is arched forward. It's concave from behind. And the lumbar spine down at the bottom is the same way. It's arched forward. Well, depends how you'd interpret arched forward. It's concave when you look at it from behind. The thoracic spine is the opposite way. When you look at it from behind, it's bowed towards the observer. Like those curves, if they weren't there, and you landed from a jump, you'd have just one solid piece, bam. When you've got a bit of a curve there, what does it do? Well, it gives a little bit of spring. It makes it easier to absorb the shock of a jump. I guess I don't have the magic touch to make it go fast. Now, we're going to focus a little more on the lumbar spine because, if you remember, that's the main area that gives the troubles. It's the head of all the other areas of the spine. It's the head of all the other areas of the body in terms of pain that human beings have. And so we'll look at those 5 vertebrae. You name them. They're lumbar is the term for all 5 of the lowest and biggest vertebrae in the body. And so they just number them, L1, lumbar number 1 and 2, 3 down to 5. And below the lumbar spine, and carrying the weight of it is the sacrum down here. Here's another look. It's interesting that the spinal cord actually officially ends way up at L1 or 2. And what you have down below in here, can you see the red where I'm trying to show it? That actually isn't officially called the spinal cord, although people all think of it as being there. It's really it's already the nerves that are going to make the nerve roots. When you go further up in the spine, up in the thoracic spine and the cervical spine, you have spinal cord that has gray matter just like the brain does. Nerve connections. Down in the lumbar spine, in the lower areas where people have so much pain troubles, you don't actually have all those connections. It's already the nerve that's going to go out. It's just finished. Oh, by the way, there you can have another view of the disc. Here is a view on top. This isn't showing, I guess. Do you see on the right of the screen the annulus fibrosus? You can't see the fibers, but they're circular there. And then in the middle is the creamy nucleus pulposus. I don't know if this is going to work because my battery is running out. Okay. Now here you get a little bit of a view of everything. This cut is not through the disc. Instead, it shows the vertebral body, which means it's the bone. And then you come back and you see the spinal cord is there, and it's surrounded by that dark area, which is actually fluid. It's the same kind of fluid as surrounds the brain. The spinal cord is central nervous system. And then coming out of that spinal cord, you see two structures on each side. There's this aspect and this aspect, two branches that are going to make the nerve root that comes out here through what's called the foramen. And that's on both sides. What you see down here, the spinous process, that is right at the end is what you feel when you run your finger up and down your back, the middle, the bump that you get. Now, the covering of the spinal cord is this white layer, the part of the meninges that is tough, and it has a sleeve that goes out a little ways right on the nerve root and covers it. That sleeve, the meninges, all of them are very sensitive. If they get pressure on them, the person really feels it. Doesn't want to move for me. Seth? Okay. Well, it didn't move there. I need to get this next one. There we are. Okay. Now, you notice here it says facet joints in motion. Remember, the facet joints is that pair of joints between every two vertebrae. And the facet joints then are behind the disc. There's the disc. This isn't showing my hand, but oh. I don't know. Not getting.
Where were you?
Let's just leave it.
Where were you?
We were about
Right here.
there.
Right there.
Uh-huh.
Okay.
Oh, okay, good.
And
Now, in this picture, the facet joints are in behind. You only see one, the one that's near you. I want you to look at the disc itself. You can see that in the front, in the one to the right, the disc at the front of it is a bit higher than it is over on the left. Over on the left, the person is bending forward. On the back here, he may be just standing straight, but if he actually bent backwards, it would be open even further. And if a person has trouble with their discs, the ideal position would be where you open it up and give more room to the disc. If you bend forward, you're putting more pressure on something that's perhaps been injured, and it could go out of place further. So this is illustrating a basic principle that can be used in treatment of back problems. The very common type of back problem. It doesn't work for everything, but it works for an awful lot. And that is, you would like to see if you can get the person into a position of what we call extension, bending backward, opening up the space between the two vertebrae. Oh, okay, there you've got it in French if you were interested. Now, we think of back problems as being from injuries. In fact, workers' comp is being paid all the time. They'll say, you know, the man injured his back at work, lifting something or whatever. And so the question comes, does lifestyle, in other words, the way you eat, the way you drink, your habits of living, do they have any influence on the back? Is there any influence? Well, we want to get into that. You're nodding your heads, and I hear, That's all very true. It has a tremendous influence. The cartilage in the disc is mainly water. I can't give you an exact amount, maybe 80% water. And it is of real importance that it continue to have that water. If the disc starts drying out, it starts breaking. In fact, we could summarize the influence of lifestyle on the back with a number of points. And I see that it's two. I don't know if we turned out the lights up at the front, you might see it better. I don't know if this can be made bigger, maybe not. But what it's saying there is, one of the big influences is poor posture. From what we've said, what kind of posture should a person have in this lumbar spine that gives so much trouble? Which kind of curve should it have in it? Well, what we showed in that previous slide was the disc spaces should be open. And so you want a significant amount of this curve that looks concave if you're looking from behind. There should be an arch in the back. Now, it's possible to be excessive, but most people go the other way. In fact, when you're sitting, almost always you lose a significant amount of the arch in the back. You can, in fact, lose it completely. Other things, faulty body mechanics. I think that's the most common point that is made about the back. When you lift something heavy, you shouldn't do it bending like so. It puts tremendous stress on the spine. Let your knees take part in the action. Bend here and have your spine a little more upright to lift a heavy object. So faulty body mechanics is the second point there. Third point, malnutrition. How would nutrition get involved here? The next word there is drought. That was the point about drying out, that the discs actually do dry out. And then, if a person doesn't maintain fitness, exercise that makes these muscles along the spine, if they're not maintained, then the discs and everything can go bad much quicker. You really want to have strength to help you. The last one is really a combination of those things: stressful living and working habits. Now here you can see the spinal cord, and the disc is nicely showed there in front of it, and off to each side is each of the nerve roots coming out to the right and to the left. This area right here is the facet joint from the lower vertebrae that will meet another part of the facet joint from the vertebrae that would be above it, that we've cut through. There's someone with pain in the back. What do we do? Can be from a ligament, but usually the ligament is injured or pressure is put on it because of something wrong in the disc. A very common cause of the problems in the back is the disc. Here we have a look at what happens. Up in the picture up above here, you can see the disc is already bulging out of place. You see this thing right there. The bulging disc is starting to put pressure on the nerve that's coming out to that one side. When a person hurts his back, often the first thing that he experiences is symmetric pain in the low back. And then as a few days go by, sometimes it starts going towards one side, off to the right. And what's happening is this disc material, and you can see it right here, the creamy pulp has broken through the annulus, the tough fibers. And it's coming out and putting pressure on the nerve root. So then the person feels it not just in the back symmetrically, he begins to feel it going down a leg, at least into maybe one buttock or down a thigh. What they don't show here is what came before that creamy center, the nucleus, came out. That annulus had a crack in it. And as the crack forms, it forms first from the inner part, right where the pool of jelly is. It starts cracking, and then it widens, and it goes gradually toward the outer edge of the annulus. All that time, when there's still a bit of annulus holding, so the crack is not complete, the person doesn't even know he's got a back problem. He thinks he's fine. And the reason the annulus has been cracking like that is because of what? It's dehydration. A dehydrated cartilage leading to that would make one think, well, could water help? I don't know if there's, I haven't seen a study, and I go over quite a few studies about the back because I've worked a fair amount with it. I haven't seen a study where they've really checked well on the amount of water that people drink versus who it is that gets the back pain. And I think the reason may be that it would be a complicated study. People tend to think if they're taking water in, it doesn't matter what form. It's all liquid, whether you take coffee or whether you take juices or, Coke. But actually, it's very different in terms of the hydration of the body. Caffeine we know that it definitely has an effect on the nerves. Everyone knows that. It whips your nerves, gets you going so you don't fall asleep. But it has another effect on the kidneys. The effect on the kidneys is that it lets out a bit more water than they would if there were no caffeine. It interferes with a hormone produced at the base of the brain, antidiuretic hormone, that makes the kidneys retain all the water that they can. Caffeine tells the kidneys, let out more water. Well, it's letting out more water than the kidneys would do if they were doing their job without the caffeine. So what's happening to the body when they let out more water? It's dehydrating the body. So if you're to do a study like this, you'd have to make sure you know what form the water is in. You'd have to know how much is the person taking in really pure water, how much are they taking. You have to know what they're taking of caffeinated drinks. And those are pretty popular. Let's go on here. When this process of drawing out gets going well, then what we call it is a degenerative disc. The disc really does degenerate. It actually gets thinner. I don't know if you can see that very well here, but it's very literally true. When you look at an X-ray of all those vertebrae, and here you have a good disc space, you look at one that's degenerated, and whew, half the amount, sometimes it's even all gone. The one vertebra just sits right on top of the other. This is giving you a picture of other things too, you know, the bulging disc and then the herniated disc here. And up at the top you have the normal disc with its full height. Now actually, as you go down in the lumbar spine, one of the rules in radiology is you expect every disc space to get bigger down to L5. So, what should the size of this disc space here be compared to this one? Well, it should be bigger, a little bit bigger. And it should successively get bigger right to the bottom. Well, here, I think you do have a good suggestion that it really is not getting bigger because all these things are degenerating. This is a picture of the posture issue. You really do put stresses on the back. This guy here on the left, he's quite a skeleton, and he's really, you can imagine what he's doing to that upper back. Remember what we said about the disc space? Which is the direction that's going to open up the disc space? It's actually straight up and even bending a little bit back. Well, this guy is hunched way over. The one on the right is doing a good job. Forward head posture in the cervical spine. I think it's too small for you to read all these things. I'm not going to read them all, but you've got these elongated, inactive, and weak upper back muscles. So you're overstretching the muscles, they're not working as well, and you're putting all that pressure on those discs. This is kind of interesting, and again, it's too small for you to read well, but you can see, maybe, I hope, that on the left, the person is holding his head nearly upright. You know, he's standing there with his head nearly upright, and the amount of force on the cervical spine in the neck, it says, is 10 to 12 pounds. He's carrying his head. You know, every disc is handling that pressure of the weight of the head. You go to the next one, and he's bent forward. It says 15 degrees. So instead of being upright, he's now forward 15 degrees, and the amount of force through the neck is 27 pounds. The next one, he's bent forward twice as far, 30 degrees, and the force now through the neck is 40 pounds. The next one is 45 degrees, and the force now is 49 pounds, and the next one is 60 degrees. Do people ever bend forward that much? Well, at times. And it's not bad to bend forward and then get back up. The discs are made to be flexible. In fact, that can help get the water moving. Remember that fluid that's around the disc? It can get it in and then get it, it squeezes it out, and then when you get back up, the water gets in and gives nutrition to the disc. But when a person stays like this for quite a while, you're really being hard on the disc. The water, the nutritious fluid of the joint is not getting in. You're putting the pressure, you know, many pounds extra on all those discs. Another picture of the same kind of thing. On the right, you see a bad sitting posture that can lead to neck pain as well as low back pain. Okay. Here are some pictures of the way people are. Now, the second one from the left, that's really excessive. If we were to go through the amount of force involved, that actually does make excessive force on the spine when you got a real heavy curvature. But the problem that most people have is the other way, where they've lost their curvature in the spine. What about, here's a fellow that's just nicely relaxed. How's his posture? Well, let's think of it in terms of what we already said. Look at his low back. Okay, can you see that there? Just to the left of his rear end. Okay. What position does his low back have? It's curved in a forward way like this. Now, I'm not relaxing back, but his low back is bent forward. Can you see that? So this very relaxed position that you think, boy, he's just at his ease and everything's fine, is actually hard on his low back. Smoking, could that have anything to do with back pain? You wouldn't think so. Anyone can understand that smoking would cause problems to the lungs, taking in smoke into your lungs. So yes, lung cancer and emphysema. But what could it have to do with the back? Well, do you know what the most common cause of death is in smokers? The most common cause of death actually isn't lung cancer, and it's not even emphysema. The most common cause of death in smokers is the same as for the population in general. What's the number one cause of death? Heart attacks. And then you say, so smokers are no different. Oh, yes, they are. They get their heart attacks way sooner. It's much more frequent in smokers than it is in the general population. Why? Because the nicotine causes blood vessels to constrict. And when the blood vessels constrict, and if there's any plaque of cholesterol there, you're going to block them off pretty easily. Now, I suppose if a smoker were really careful to be a good vegetarian and have really clean arteries, I don't know of people like that, but then it would be a little better for him. But the usual smoker, of course, he's got the other health problems, and that blockage in the arteries that causes heart attacks, everywhere in the body depends on that blood supply. So the blockage is not just going to be in the arteries of the heart, it's going to be in the arteries that go to supply the spine. And what happens is the discs dry out because they're not getting the blood flow that they need. I remember when I was studying this, I'd see one and another study about how smoking is related to back pain. And finally, I saw a review that went through how there were loads of studies that showed the risk for back problems, spinal problems in smokers. In anything in science, when you have a number of studies, you can have some that will say there's no effect. In this issue, there might have been one or two out of many, many studies that said there was no effect. All the rest said there was an effect that it doubled the risk or tripled the risk of back pain. Smokers really do have lots of increased spinal pain. Now, there are some things that are not just drawing out of the disc. There are tumors that can happen in the spine, but those are comparatively rare. The real problem is what we've already mentioned. That's what causes the problem 95% of the time, maybe more than that. Okay, just more pictures of the herniated disc. Let's go. You can see here when you have what they're calling a thinning disc, you can see how it really has narrowed. And on x-rays, you see this frequently. where the disc space has just narrowed right down. They're showing that near the bottom. And on the lower one yet, the lowest disc that you see there, you can see there are bumps on the bones. These are spurs that develop as the disc starts bulging out and pulling off membrane on the bone, so the bone makes more bone, which becomes bone spurs that give trouble. Person loses his mobility, flexibility. There you can see it more easily on the top there, bone spurs that have formed, and the narrowed discs. Now, what do we do if someone comes with back pain? Well, I don't jump to doing studies. You know, you can spend quite a bit of money on doing x-rays of various types, MRI. You can spend $500 to $1,000 at, you know, just one study. EMG, I guess my thing is given out. EMG is a study where you actually see the function of those nerve roots. If they're being blocked, then you can see that it affects the muscles. Usually, if a person has back pain, the best thing to do is to have them rest, but not too long. A day or two, it's been found, is the best. And if the person can, they should start walking as soon as possible. If you have all the people with back pain staying on bed rest for a week, they're going to start atrophying those muscles. They start getting thin and weak, and the person many more end up as invalids than if you have them start walking. What else should they do? Well, we do work here at UC Pines teaching them how to get the positioning back in the spine. How's our time here? Yeah, I'm supposed to finish. I'll just show you briefly what's involved. It's arching backward. If a person doesn't have back pain right now but wants to prevent it, the first simple thing to do, especially if you work in a job where you're bent forward, like nurses attending patients in bed, bending over like so, or even just a job where you're sitting, every hour or two, it would be really good if a person stood up. When you stand up, if the spine is not injured, you generally have a little bit of an arch there, but then you should accentuate it. Put your hands here and then bend back over your hands to be opening up those disc spaces. If the person has back pain, then you do the same kind of maneuver, but with them lying down, so there's no pressure of body weight. And we start doing other things, pushing on the vertebrae, mobilization procedures. I think right now it would be worthwhile for you all just try doing this maneuver that I was showing you. I've been talking to you about the back, and here you've all been sitting, putting more pressure on your spine discs than I have. I've been kind to my spine. So if you want to stand up, do it with me. And take your hands, make the lower palm of the hands fit right in here, just above the buttocks, and then bend backward around that. And just let it sit there, rest for a moment, and then back up. Let's do that 3 times. It's just a gentle maneuver. 2 and 3. Good. You've been kind to yourself. You can sit back down and put the pressure and stress on your lumbar spine again if you want. Anyway, I'm now to be quiet. I don't know if there are any questions on what we've said. We didn't take much time for the treatments that we do, but that gives you a little bit of an idea. No questions? Okay, yes?
Does the normal x-ray show those bone spurs?
Yes, the x-rays show all the bones usually pretty well.
Doesn't have to be an MRI.
The MRI will show the actual disc structure. A person that has no bone spurs, a person that's in their 20s and has been doing well, and then he can get a herniated disc, That herniated disc, like we showed on the slide there, that will not show on the plain x-ray because it's soft tissue. It's not bony. So the MRI is needed then. But I want to say again, if you get back pain, even if it is a disc problem, don't jump at getting an MRI because it shouldn't change what you do. What you should do, you should not let any knife come near you. You know, there's some people that handle knives called surgeons, and they're quite ready. That's the way they make their living. So they're quite ready to cut in and take out the piece of disc that's going against the nerve root. And yes, it can relieve the pain, but with any surgery, you're going to have scarring. Scarring is part of the healing process, and unfortunately, when you're right by nerve roots, you really don't want scarring that can put pressure on its own on the nerve root. So just take your rest for a day or two, and then try walking and getting back into shape as soon as you can. Usually, for x-rays, most doctors, if they're following the protocols, which are very sensible, will wait at least 2 weeks. And the same for MRI, maybe even a little longer. Okay. Yes?
So when you rupture a disc, that the hard cartilage part, that actually breaks and the fluid comes out?
Exactly, yeah. I didn't have enough of the pictures here to show how when it opens up, you don't have to have a big opening, but as soon as you have, just like on a tire, the tiniest of holes, out it starts streaming. And one of the problems is that that material in the center of the disc, that nucleus pulposus, it's a chemical substance that your blood has never come in touch with up till then. It's hidden deep. The disc has no blood flow. It's a rather unique thing. And when it breaks like that and you have this nucleus coming out, it is a reaction that happens because the immune system sees this as something foreign. It's never encountered it before, unless you had back pain before. The first time it causes quite an inflammatory reaction. So it's not just mechanical problems, it's actually an inflammatory reaction that's part of the back pain that occurs. Okay, yes?
What about when you have the S curvature of the spine, scoliosis? Are there things that you can do to help?
Yeah, you can. It's a very different problem. When you have curvature, when you're looking at the back, the curves that we talked about when you're looking straight at the person's back, those curves don't show up. You have to look from the side. But what scoliosis is when you're looking straight at the person's back, he's got curves there. It should have been vertical, but you've got curves. Yes, scoliosis up to 20 degrees, they usually don't do anything about. A person can usually get along well. But if it's more than 20 degrees of curving, up to 40 degrees, they'll put the person in a brace. And the brace does help. It helps it from getting worse. It doesn't, I don't think it really corrects fully, but it does keep it from getting worse. And if it's more than 40 degrees, boy, it can get to the point where it keeps on increasing. You know, if you've got too much of a curve in the spine, then the weight above starts increasing the curve. That's why you don't want too much of that forward bend in the low back either, just a gentle curve. So a person that has scoliosis, yeah, that's a big problem. We haven't really dealt with it here. Okay. Yes, sir.
What about these special chairs they have, ergonomic chairs and things like that? Is that just marketing?
Have you seen how some of them are inclined?
Yes.
Where you sit, instead of being flat like the pews here, they're down. The person sits with his knees out here, a rear end here, and the back coming off. And then, if the person wants to be upright, he has to put his back like so. So what is he doing to his low back? He's arching it, isn't he? So it's encouraging that very opening of the disc spaces. So there's good thinking in those things. I don't know if a person would want to sit in them like that all day long. It's kind of a little odd, but it can help the person. Yes?
If there's someone that has injured and they go out and do some heavy work, do you recommend that they wear a brace when they are working, or does that further weaken?
That's a real good question. Wearing a brace right when the person's having the stress of working is reasonable, especially if they're in pain. Now, if they're well past the pain, they might be able to get along without it. But one thing that I want to warn about is a person should not, it's really counterproductive to be wearing a brace all the time. This has been found that the brace, holding the back upright, the muscles actually shrink. They waste away. And so some people that wear braces all the time are actually doing themselves a real disservice. But to wear it right at the time that there is excessive strain, that makes good sense. Okay. Have a good day.